Sangachadvam samvadadvam Sangachadvam samvadadvam Samvo manamsi janatam Samvo manamsi janatam Deva bhagam yatha purve Deva bhagam yatha purve Sanyanana upasate Sanyanana upasate Sanyanana upasate Sanyanana upasate Sanyanana upasate Sanyanana upasate.
Neck movements. Forward and backward neck bending. Caution: avoid this practice in case of severe cervical spondylitis. Start with alert posture samsthiti. Stand with feet 2-3 inches apart. Keep the hands straight beside the body. Now, keep the hands on the waist. While exhaling, move the head forward slowly and try to touch the chest with the chin. As you inhale, bring the head to the center position. While exhaling, move the head backward comfortably. Bring the head to the center position. This is one round. Repeat for one more round. Right and left neck bending. Caution: do not overstrain during this practice. While exhaling, bend the head slowly to the right and bring the ear as close as possible to the shoulder without raising it. Experience stretching on the left side. As you inhale, bring the head to the center position. While exhaling, bend the head slowly to the left side. Experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Right and left neck twisting. Caution: do not jerk the neck. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in line with the shoulder. As you inhale, bring the head to the center position. While exhaling, gently turn the head to the left. Feel or experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Neck rotation. Caution: people with neck pain and cervical spondylosis, do this practice carefully. Exhale. Bend the head forward, trying to touch the chest with the chin. Inhale slowly. Rotate the head clockwise in a circular motion. And exhale while coming down. This is one round. Repeat for one more round. Then rotate the head in an anti-clockwise direction. Inhale, go back, exhale, and come down. This is one round. Repeat for one more round. Inhale and bring your head to the center position. Exhale. Bring the arms down and relax. Shoulder movements. Shoulders and arms movement. Caution. Frozen shoulder patients should do this practice carefully. Start with alert posture, samsthiti. Stand with feet 2-3 inches apart. Place the hands by the sides. Keep the fingers together, pointing downwards. While inhaling, move both the arms from the sides up above the head, with the palms facing outward. Exhale and bring them down. This is one round. Repeat for one more round. Shoulder rotation. Stand straight. Inhale and raise both the arms up to shoulder level by the sides. Bend the arms at the elbows. Place the fingers on the respective shoulders. Try to touch the elbows in front of the chest and then rotate both the elbows and shoulders in a circular manner. This is one round. Repeat for one more round. Inhale while raising the arms and exhale as you bring them down. Repeat the same in a reverse manner for 2 times. Inhale while raising the arms and exhale as you bring them down. Now inhale and stretch the elbows by the sides. Exhale, bring the arms down and relax. Tadasana, palm tree posture. Tada means palm tree or mountain. This asana teaches one to attain stability and firmness and forms the base for all the standing asana. Benefits. This asana brings stability in the body, helps to clear up congestion of the spinal nerves and corrects faulty posture. Caution. Avoid lifting the toes in case of acute cardiac problems, varicose veins and vertigo. Alert posture. Stand with feet 2-3 inches apart. Place the hands by the sides. Inhale. Lift the arms to the shoulder level from the front and interlock the fingers. Exhale. Turn the palms outwards. Now inhale and stretch the arms over your head. Raise the heels off the floor and balance on the toes. Maintain the final position for 3 to 5 breaths with body awareness. Bring the heels down. Release the interlock of the fingers. Exhale. Bring the arms down by the sides and come back to the starting position. Relax. Ardha chakrasana, the half wheel posture. Ardha means half. Chakra means wheel. As the body takes the shape of a half wheel in this posture, it is called Ardha chakrasana. Benefits. This asana makes the spine flexible and strengthens the spinal nerves and muscles. It helps in the management of cervical spondylosis. Caution. Avoid this posture in case of vertigo or a tendency to giddiness. Hypertensive patients shall bend with care. Stand with feet 2 inches apart. Support the back at the sides of the waist with fingers. Try to keep the elbows parallel to each other. Inhale. Drop the head backwards while stretching the front side of the neck. As you exhale, bend backward from the lumbar region. Maintain the final position for 3 to 5 breaths with body awareness. Inhale and slowly come up. Exhale and return to the starting position. Relax. Prasarit padastasana. Wide-legged forward bend. Prasarit means extended. Pada means feet and hasta means hands. Is a yoga pose that involves folding forward while standing with your feet wide apart. Benefits. This asana makes the spine flexible, improves digestion, and helps in overcoming menstrual problems. Caution. Avoid this practice in case of cardiac disorders, vertebral and disc disorders, abdominal inflammation, hernia and ulcers, glaucoma, myopia, and vertigo. Stand straight with the feet 2-3 feet apart and arms relaxed alongside the body. Inhale. Raise both arms above the head from the front. Keep the arms close to the ears with palms facing forward. Exhale. Slowly bend forward without hunching. Place the palms on the ground between the feet, keeping the knees straight. Maintain this pose with normal breathing. Inhale. Slowly return to the upright position. Exhale. Bring the arms down. And bring the legs close together. Relax. Kati chakrasana. Lumbar wheel posture. Kati means waist and chakra means a wheel. In this asana, the waist moves like a wheel. Therefore, it is named as Kati chakrasana. Benefits. The waist becomes slim and supple, and the chest expands. It relieves constipation and makes the lumbar region strong. It strengthens shoulders, neck, arms, abdomen, back, and the thighs. Caution. Do it slowly with normal breathing. Cardiac patients shall do with care. Avoid this practice in case of severe back pain, vertebral and disc disorders, after abdominal surgery, and during menstruation. Stand straight with the feet shoulder width apart and arms relaxed alongside the body. Inhale. Lift both arms to shoulder level in front of the body, with palms facing each other. Exhale. Twist the torso to the right so that the left palm moves close to the right shoulder and the left elbow remains at shoulder level. Hold the position for a few seconds with normal breathing. Inhale. Return to the center. Exhale. Twist the torso to the left so that the right palm moves close to the left shoulder and the right elbow remains at shoulder level. Hold the position for a few seconds with normal breathing. Inhale. Return to the center. Exhale. Bring the arms down alongside the body. Relax. Trikonasana, the triangle posture. Trikona means triangle. Tri means 3 and kona means angle. As the asana resembles the shape of a triangle made by the trunk, arms and legs, this asana gets the name Trikonasana. Benefits. This asana makes the spine flexible, strengthens calf, thigh and waist muscles and improves the capacity of lungs. Caution: avoid this posture if you have slipped disc or sciatica. Avoid this posture after undergoing an abdominal surgery. Do not try beyond limits and overdo the lateral stretch. If you cannot touch the feet, you can reach for the knees instead. Assume the alert posture and step the feet 3 feet apart. Inhale and raise both the arms from the sides up to the shoulder level with palms facing outwards. Turn the right foot towards the right side. Exhale. Slowly bend to the right side and place the right hand just behind the right foot. Turn your head and gaze at the tip of the left middle finger. The left arm is straight in the line with the right arm. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Slowly come up and bring the right foot back. Repeat on the other side. Turn the left foot towards the left side. Exhale. Slowly bend to the side and place the left hand just behind the left foot. Turn your head and gaze at the tip of the right middle finger. The right arm is straight in line with the left arm. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Slowly come up and bring left foot back. Exhale. Bring the arms down and feet together. Come to the starting position and relax. Badrasana, the firm or auspicious posture. Bhadra means firm or auspicious. Benefits: this asana helps to keep the body firm and stabilize the mind. Helps during pregnancy and relieves abdominal pain often experienced during menstruation. Caution: avoid this practice in case of severe arthritis and sciatica. Note: if your thighs are not touching or are not close to the floor, place the soft cushion underneath the knees for support. Start with Vishrama Asana. Support the back with hands. Body should be relaxed in a long sitting posture. Sit straight with the legs stretched out in the front. Keep the hands beside the hips and palms resting on the floor. This is Dandasana. Now bring the soles to the feet together. Exhale. Clasp the toes with the hands. Inhale. Put your heels as close as possible to the perineum region. Maintain the final position for 3 to 5 breaths with body awareness. Exhale. Release the hands and stretch out the legs in the front. Support the back with hands. Relax. Shashakasana, the hare posture. Shashak means hare. The body in this pose resembles the hare. Benefits: this asana helps to reduce stress and anxiety. It tones up reproductive organs, relieves constipation, improves digestion, and helps to relieve back pain. Caution: patients with osteoarthritis of the knees and acute backache should avoid this asana. Start with a long sitting posture. Sit straight with the legs stretched out in the front, palms resting on the ground and fingers pointing forward. This is Dandasana. Fold the right leg at the knee and place the foot under the right buttock. Similarly, fold the left leg and place the left foot under the left buttock. Place the hands on respective knees. Inhale. Spread both the knees wide apart. Place the palms between the knees. Exhale. Bend forward with arms outstretched and place the chin on the ground. Keep the arms parallel. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Come up and close the knees together. Bend a little towards the right side to take the left leg out and extend it. Similarly, extend your right leg and return to the starting position. Relax. Vakrasana, the spinal twist posture. Vakra means twisted. In this asana, the spine is twisted, which has a rejuvenating effect on its functioning. Benefits: increases flexibility of the spine, helps to overcome constipation, dyspepsia, stimulates pancreas and helps in the management of diabetes. Caution: please avoid this posture in case of severe back pain, vertebral and disc disorders, after abdominal surgery and during menstruation. Start with long sitting posture. Sit with the back straight and legs stretched out in front. Bend the right leg and place the right foot beside the left knee. Place the right palm beside the body. Bring the left arm around the right knee and place the palm beside the right foot. Inhale. Stretch the back. Exhale. Turn the body and head to the right. Maintain the final position for 3 to 5 breaths with body awareness. Inhale and come back. We will now repeat the same on the left side. Bend the left leg and place the left foot beside the right knee. Place the left palm beside the body. Bring the right arm around the left knee and place the palm beside the left foot. Inhale, stretch the back. Exhale, twist the head and body to the left. Maintain the final position for 3 to 5 breaths with body awareness. Inhale, come back to the starting position. Relax. Macarasana, the crocodile posture. In Sanskrit, Makara means crocodile. In this asana, the body would resemble crocodile, hence this name. Benefits: this asana promotes relaxation of the whole body. It helps in the recovery of back problems. Caution: avoid this practice in case of pregnancy and frozen shoulders. This asana is practiced for relaxation in all prone postures. Start in Vajrasana. Slowly lie down on the stomach with feet together and toes pointing outwards. Place the chin on the ground. Stretch your arms forward. Open the feet apart with toes pointing sideways. Bend your elbows and rest the chin on the hands. Lift the head up and place your cheek on the hands. Close the eyes and allow the entire body to relax. Maintain the final position for 3 to 5 breaths with body awareness. Remain aware of the body and breathing. Bhujangasana, the cobra posture. Bhujanga means snake or cobra. In this asana, the body is raised like the hood of a snake. Benefits: this asana relieves stress and constipation, and reduces abdominal fat. It helps to relieve backache and bronchial problems. Caution: those who have undergone abdominal surgery should avoid this asana for 2-3 months. Those who are suffering from hernia or ulcers should not practice this asana. Start with Macarasana. Now join the legs. Stretch your arms forward and rest the chin on the ground. Now place your palms beside the chest and elbows close to the body. Inhale slowly and lift the head and chest up to the navel region with the help of the spinal muscles. Keep the elbows parallel. Maintain the final position for 3 to 5 breaths with body awareness. Exhale. Bring the head down and rest your chin on the ground. Relax in Macarasana. Ardha halasana, half plow posture. Ardha means half and hala means plow. This posture is known as Ardha halasana because in its final position, the body would resemble half the shape of an Indian plow. Benefits: this asana relieves constipation and is beneficial for hypertensive patients. However, it needs to be practiced under supervision. Caution: those who have lumbosacral, that is lower back pain, should not perform with both the legs together. Avoid this practice in case of abdominal injuries, hernia, etc. Lie comfortably on the ground with legs stretched out. Keep hands placed by the side and palms facing down. Inhale. Slowly raise both the legs without bending them at the knee and bring them vertical to the ground. The body from hip to shoulder should be kept straight. Maintain the final position for 3 to 5 breaths with body awareness. Exhale. Slowly bring the legs down to the ground without lifting the head. Relax. Setubandhasana, the bridge posture. Setubandha means formation of bridge. In this posture, the body is positioned like a bridge, hence the name. This is also called Padastasana. Benefits: it relieves depression and anxiety and also strengthens the lower back muscles. It stretches abdominal organs, improves digestion and helps to relieve constipation. Caution: people suffering from ulcer, hernia, etc. should not practice this asana. Lie down on the ground. Stretch out your legs comfortably and place the palms facing downwards. Bend both the legs at the knees and bring the heels near the buttocks, while holding both the ankles as per your convenience. Inhale. Slowly raise your buttocks and trunk up as much as you can to form a bridge. And maintain the final position for 3 to 5 breaths with body awareness. Exhale. Slowly bring your hips down and straighten the legs in supine position. Relax. Pavanamuktasana, the wind-releasing posture. Pavana means wind and Mukta means to release or to make free. As the name suggests, this asana is useful in removing wind or flatulence from the stomach and the intestine. Benefits: it removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen and aids digestion. It generates deep internal pressure and improves stretching of the highly complicated network of muscles, ligaments, and tendons in the pelvic and waist regions. It tones up the back muscles and spinal nerves. Caution: avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Lie comfortably on the ground with legs stretched out, hands placed by the sides and palms facing downwards. Bend both the knees. Exhale. Bring the knees towards the chest. Inhale. Interlock the fingers and clasp the shin below knees. Exhale. Raise the head up until the chin or nose touches the knees. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Bring the head back to the ground. Exhale. Release the legs back to the floor. Lie down in supine position. Relax. Shavasana, the dead body posture. Shava means dead body. The final position in this asana would resemble a corpse or dead body. Sthiti, Shavasana, supine lying posture. Benefits: this asana helps to relieve all kind of tension and gives rest to both body and mind. The mind, which is constantly attracted to the outer world, takes a U-turn and moves inwards, thus gradually getting absorbed. As the mind turns quiet and absorbed, the practitioner remains undisturbed by the external environment. It is found beneficial in the management of stress and its consequences. Lie down on the ground. Open the feet apart, with toes pointing sideways and palms facing upwards. Close your eyes. Consciously relax the whole body. Become aware of the natural flow of breath. It will tend to become slow. Remain in the position until you feel refreshed and relaxed. When ready to release, slowly stretch your arm over the head and join the feet. Then turn by the side, either right or left, and come back to the sitting position with the support of the hands. Yogic deep breathing. There are 3 types of breathing: abdominal, thoracic, clavicular. Combination of all 3 types of breathing becomes yogic deep breathing. Benefits: this practice increases breathing and lung capacity, correct poor breathing habits, and increase oxygen intake. Caution: the whole process should be one continuous movement, each phase of breathing merging into the next without any obvious transition point. There should be no jerks or unnecessary strain. Yogic deep breathing. Sit in any meditative posture, Sukhasana or Padmasana. Rest your hands on your knees in Dhyana Mudra with your eyes closed. Inhale slowly and deeply, allowing the abdomen to expand fully. Expand the chest outward and upward. Inhale a bit more to fill the upper lungs. Let the shoulders and collarbone rise slightly. Feel the breath filling your lungs completely. This completes one inhalation. Begin to exhale by relaxing the upper chest and shoulders. Let the chest contract. Then allow the abdomen to draw inward. This completes one round of yogic breathing. Repeat for a few more rounds. Pranayama. Nadi shodhana or Anulom Vilom Pranayama. Alternate nostril breathing. The main characteristic feature of this pranayama is alternate breathing through the left and right nostrils without or with retention of breath, that is kumbhaka. Benefits. The main purpose of this pranayama is to purify the principal channels of carrying energy, called nadis. Hence, nourishes the whole body, induces tranquility and helps to improve concentration, increases vitality and lowers the level of stress and anxiety. It elevates cough disorders. Start with sitting in any comfortable posture. Breath should be slow, steady and controlled. Keep spine and the head straight with the eyes closed. Relax the body with few deep breaths. Keep the left palm on the left knee in Jnana Mudra and the right hand should be in Pranayama Mudra with the middle and the index fingers folded like this. Close the right nostril with the right thumb and exhale completely. Now inhale through the left nostril. Recognize the touch of air moving through your body as prana. Then close the left nostril with the ring and little finger of the right hand and exhale through the right nostril. Now inhale through the right nostril. Close the right nostril with the thumb and exhale through the left nostril. This is one round of Nadi Shodhana Pranayama. Repeat it for 4 more rounds. Bhramari Pranayama. Bhramari is derived from Bhramara, which means black bee. During the practice of this pranayama, the sound produced resembles the buzzing of a black bee, hence the name. Benefits. It relieves stress and helps in alleviating anxiety, anger, and hyperactivity. It creates a soothing effect on the nervous system and mind. It is a great tranquilizer and found good in the management of stress-related disorders. It is a useful preparatory pranayama for concentration and meditation. Caution: please avoid this practice in case of nose and ear infections. Sit in any comfortable posture. Keep the spine and head straight with the eyes closed. Place the hands on the knees in Jnana Mudra and inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat 1 more round. Practice the Bhramari Pranayama with Sanmukhi Mudra. Using your index fingers, gently close your eyes. Then place the middle finger beside your nose without fully covering it. Place your ring finger on your upper lip and your pinky finger on your lower lip. Finally, rest your thumbs on your ears as demonstrated in the video. Inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat 1 more round. Dhyana. Sit in any comfortable position. Place the hands on the knees. Close your eyes. Now adopt Dhyana Mudra and sit in a slightly upturned face. You need not concentrate. Just maintain a mild focus between the eyebrows and be conscious of your breath. Let them flow freely. Just observe the flow. If possible, let the thoughts dissolve.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति।